Hey everybody, I'm Faith here. Welcome back to our live surgery channel. So I'm very excited to give you the concept and clinical steps involved in pin guide surgery and immediate implantation. So obviously this lecture will be about minimally invasive approach to immediate implant surgery, which focus on high-yield topics for clinical application of pin guide mapping. So let's start with our patient. The patient has come to our clinic with her chief complaint of some of her lower teeth showing severe mobility like 3 to 4 degree. As past dental history, the lower anterior teeth have been stabilized with wire splint. Present illness includes that the patient has severe chronic periodontitis with bone resorption on 31 through 42 and 37 area. Also, the patient has missing tooth on 41. So the radiograph shows the patient has had orthodontic treatment before. In this clinical photo, we can see the ponic for 41 is fixed with retainer wire on linear surface. So today's surgery plan is to extract teeth including 31, 32, and 42 and perform flapless implantation on 32 and 42 using pin guide with bright TL implant and accompanied with some of bone graft. So the prosthetic plan of the finished result is to make 4-unit implant supported bridge from 32 to 42. So before proceeding to surgery, pin insertion planning, also known as preoperative planning, is conducted based on the CT scan. In this case, the operator has decided to put the straight angle pin in parallel pattern. So bone mapping with pin guide system is highly optimized for flapless and immediate implant surgery. The illustration at the bottom indicates that the direction of the pin guided pin depends on the shape of the bone and the contour of the bone. Just because you can't elevate the flap doesn't mean you can't do immediate implant surgery. Here we have a really nice schematic showing the process of pin guide surgery. First, you need to insert the pins to the position right below the bone periosteum. So the 2 pins are inserted, and the interval between the 2 pins indicates the width of the bone, and the angle formed by 2 pins indicates the shape of the bone. Once you get the information about the bone, you just need to determine the pathway and perform the drilling and implantation according to the pathway. So this tissue level type of bright implant has flared up platform which allows the implant to be rested under the periosteum. The good thing about the tissue level implant is that it is machined as double thread, which enables more bone implant contact area. Also, another thing is that it can preserve sufficient amount of a bone in order to support the volume and the height of the bone. So this schematic diagram shows the direction of drilling pathway and implantation pathway. Could be changed depending on which angle you decide to use. On the left image, straight angle pins are inserted both sides, and on the middle of the image, 25-degree angle pins are inserted both sides. On the right image, 25-degree angle is inserted linearly, whereas straight pin is inserted buccally. So we can say that the buccal side pin is adjusted for tilted pathway of axis. Planning and selecting the angle pin for the right one is very important for predictable and successful outcomes. So basically, the pin guide system is composed of 4 elements: guide pin, pin holder, marker, and burr, some drills. And so pin guide assist the surgery protocol definitely requires skillful use of these tools. First, marker is used for marking points, which is placed through mucogingival junction. Then you insert the guided pins with pin holder. Guided pins are divided into 3 categories: straight 20.5 degree and 25 degree. Additionally, round burr and this guide drill are needed to either to make a hole or to perform some osteotomy. So now I'm going to review a similar case with a different patient. This patient has poor oral hygiene, and some of mandibular anterior tooth are extensively decayed. So the operator has decided to extract 31, 41, and 42. So straight pins are inserted in accordance of long axis of lower right canine. The rest of the pins are inserted parallel to the previous ones. So 2.5 point drill is used for initial drill. Then sequential drilling is followed with 3.0 drill from TL kit. The implants were about to be placed on 31 and 42 with the size of 2.5 by 11. So we can see that TL implants were inserted into the proper osteotomy sites. And the thing is that you should insert the implant up to the point where the top of the platform is like 2.5 below the soft tissue. And CT scan was taken, and we can see the both of implants were precisely inserted into the place where we want it to be. And healing was complete, and ready-made abutment product from Dentium were oriented. 42 has a collar height of 2.5, whereas 31 has a collar height of 1.5. The final prosthesis was restored with PFM, porcelain fused to metal prosthesis. So he's pulling out 31 with elevator, and then go to 42 right after. It's interesting that he doesn't extract the adjacent teeth right next to 31. So now forceps extraction on 32. So there are 3 empty extraction sockets ready for immediate implantation. And curettage is just performed to get rid of granulation tissue and inflammation tissue. He's doing the cleansing with the round burr. And it seems like he takes great care on 32, which has been chronically inflamed lesion for a long time. So he's doing marking on mucogingival junction for pin insertion point. So doing the marking on buccal side first. So straight angle pin is inserted on 32. Again, another straight pin is inserted on the buccal side of 42. So he's trying to insert another straight pin on the lingual side, and he just do it like in consecutive order. So I think he was trying to show the lateral side of the pin very clearly to show which angle he's trying to use. So we can see that just bone mapping was just done, and bone profile was decided. So drilling is performed with point drill, also known as guide drill, for the initial step. So once the bone profile is identified, he just performed the drilling and implantation. And the drill is switched to 2.5 implant drill from TL tissue level kit. And now it is switched to the larger one 3.0 twist drill for more enlargement. So it's a point 0.5 bigger than the previous one. So 3.5 twist drilling on 32. It seems that he's going to do it only on 32. So it's 3.5 by 9 is installed on 32. And rechatting is done for more tightening. So 3.0 by 9 is installed for 42. Again, rechatting is done after implant is inserted. So he takes out all the pins he inserted. And he's doing rechatting like for several times to make a double check. White plastic cap on the top is taken off. And healing abutment for fixture are connected instead. So the operation was just done, and then we'll take a just short break for 10 minutes. So again, there we have healing abutment for tissue level implants on lower anterior mandibular area. And so this is the panoramic X-ray taken after the operation, inserting skin body and provisional restoration prior to delivery of final restoration as possible. So these are the images of post-op CT scan compared to pre-op. So the post-op version CT scan shows that the implants are placed as according to our pin insertion plan. With guided pin and tissue level implant, placing implants on limited structure of bone is possible. So the question we get is, what are some tips for inserting intraorally if it is difficult to get an access to insertion site? Usually you need to use pin holder to feel the tactile sense, like getting tactile feedback about the right insertion site. But if you don't get the right feeling, there is a special pin forceps which is being proceeded for a new product development. All right, that's it for today. So I hope you enjoy the video, and the next one is coming up on July 4th, 2025.